29% of Minnesota's school-age kids say they struggle with their mental health.
And at the same time, most of the state has a severe shortage of mental health professionals. So what can families do if they need help? We got Sue Everholden with NAMI Minnesota joining us this morning to walk through some of these suggestions. Sue, thanks for being with us today.
Absolutely.
I've gone through this journey. Lots of friends of mine have gone through this journey too. And you will call up a place and they will say, I'm sorry, we're not seeing any patients right now. We've actually closed our wait lists. Other places will say our wait lists are 3 or 4 months long. What do you do if you run into that scenario?
I would actually call your insurance company and tell them that there are no providers who can see new patients and that you want another referral. And so often insurance companies will provide an out-of-network provider, but actually pay them in-network so that you don't have to pay higher copays. The other thing I would do is actually contact your school. Many schools have what we call school-linked mental health programs, and while they may have wait lists too, you may be able to get in to see them sooner.
So a lot of times we hear about misconceptions around younger people and mental health. What are you seeing, and can you walk us through some of those misconceptions that you're hearing about?
I think the hardest thing is teenagers, right? So parents may see something, maybe a child is moody, maybe they're kind of angry all the time, or they're isolating themselves, and they say, well, that's typical teenage behavior. And, a day or two here and there, sure, that's typical behavior. But when you're seeing that consistently over several weeks, that is no longer typical behavior, and it's something that you should actually be concerned about. It's not a phase.
We talked, Sue, about the shortage of providers, but it's especially acute when you talk about the shortage of BIPOC providers there as well. What do we do, if you are someone who's BIPOC and you say, I'd like to see someone who's in my community who looks like me? What kind of advice do you have for people out there that are looking for a therapist that looks like them?
I will say it is very tough in Minnesota. 88% of our therapists are white, but they do exist. And so there are some culturally specific organizations around, especially the Twin Cities, places like Wilder and Change Inc., Kente Circle, Bracken's Consultant. There are organizations that exist. You just have to dig a little deeper. There are websites that actually list out different culturally specific providers, and so that's a place to go to as well. And we're actually on the NAMI Minnesota website just updating our list as a way for people to find out. But again, you can also still call your insurance company and say, what providers do you have in our network that are from culturally specific communities?
Sue, I'm so glad you brought that up, because that's actually something that I've done before, is actually look on through our insurance and say, well, are there persons of color that I can use as a therapist?
Right.
And actually they refer me to places out of state. So telehealth really comes into play here.
Yeah.
Telehealth, we know during the pandemic, it played a huge role, but even now, telehealth is still playing a huge role in this.
It certainly does. The one thing I would caution is sometimes it doesn't work as well with teenagers, and it doesn't work as well with younger children. It can work and it can be great, but you just want to also make sure that, especially for your child, that they are getting, kind of the intensity of the help that they need, and that they're actually connecting with the therapist over the computer.
So if you could sort of wave your magic wand, and that would be great if I gave you one because you were headed to the state capitol today, but if you could, what is the one thing that you want parents to understand about kids and their emotions?
It's always hard with that magic wand, but I think what I would do is really encourage them to talk to their children about their feelings, right? And model it, right? Talk about your own feelings as well. And then really listen. I think sometimes as parents, we want to step in and fix things, but we really need to help our children learn those coping skills themselves. So whether it's they're coming home from school or they're really anxious about going to school, let's do some simple breathing exercises, right? Let's get the app on our phone, whether it's Calm or Headspace, and do some, short meditations or mindfulness. We need to help our children develop those coping skills, because you know what? Life is not easy. Things happen totally outside of our control, and we want our children to have the skills to deal with those adversities.
Sue, thank you so much for joining us this morning. We appreciate your insight.
Thanks for inviting me.
Now, if you or someone you know is struggling with mental health, you can find help. You can call or text 988. That is the Suicide and Crisis Lifeline.